Hello everyone. In the last class we had discussed the lakshanas of armas. So let's now discuss the chikitsa of arma. So basically arma has been divided into two types, lekana sadhya arma and chedana sadhya arma. It is according to some features of both. So let's see lekana sadhya arma first. The reference you will get in Susruta Uttara 15 chapter 17 sloka. So the sloka says armam chalpam dadnibam neelam raktamathapiva Dusaram tanu yachani Shuklagata upachare. So when the Arma is having symptoms of alpa, which means it is in an early stage or a very small growth, and the appearance, if it is similar to that of curd, or if it has discoloration, Neela, Rakta or Dusara Varna, Dusara means greyish color, and if it is Tanu, means thin. If any of these features are present, then that Arma can be treated similar to that of Shukra. So here Shukra refers to Savarna Shukra, which is a Krishnagata roga, and the treatment will be discussed in Krishnagata rogas in detail. So if we see references according to Vagvada and Susruta, some basic common treatment has been given, like Tripla Churna with ghee or without ghee, Tiktagrita for Snehapana, Raktamokshana, Vamana Virejana, etc. and Nasya Tarpana Puttapahaka, Lekhananjanas has been explained according to Susruta and Vagvada. If you see reference according to Yoga Ratnakara, some specific yogas which is given in Shuklagata rogas can be used, such as Krishna Lohadi Yoga, Marijadi Lepa, Kharparadi Anjana, Krishnadi Puttavaga, etc., which will be dealt in detail in Krishnagata Roga Chikitsa. So next one is Chedana Sadhya Arma. So what are the features of Chedana Sadhya? The reference is 15th chapter, 18th sloka and Susruta Uttara. So the sloka is Charmabam Bahalam Yattu Snayu Mamsa Ghanavridam Chedimeva Tadarmasya Krishna Mandalagam Cha Yat. So Charmabam means it will be very thick like an extra skin. Bahalam, which means highly elevated, which indicates the depth of the Arma. Snayu Mamsa Ghanavridam, it will be covered with fibrous tissues. And the last one is Krishna Mandalagam Cha Yat, one which has entered the Krishna Mandala. So once it has reached encroached the cornea, then we should only think of a surgical treatment. And if you see according to Ashtanga Sangraha, Varja Lakshana is also told, which is Drishti Praptam to Varje. So Drishti Praptam can be compared to the pupillary margin. So where is the pupillary margin? Is it the peripheral cornea or the central cornea? Yes, it is a central cornea. So once it has reached the central cornea, even if we remove Arma, if it is leaving a scar tissue, then there won't be any improvement of vision in the patient. Hence, Acharya has told that Drishti Praptam to Varjayat. Okay. So now let's see the Chedana Karma. So Chedana Karma will be the reference. It is in Chedana Sadhya Rogas in Susruta Uttara, which is chapter number 8. And the 6th sloka gives the indications of Chedana Karma rogas, where Arma is one of the type, and the procedures starts from sloka number 4 to 7. So first let's see the preoperative procedure, which is Purva Karma. Snigdam Bhuktavadohyanam Upavishtaha. So here we have to give importance to the position of the patient, which is Upavishta, not supine position. He should be seated comfortably. He should be in a sitting position. And Snigdam Bhuktavado, he should have undergone Snehapana, and he should be well fed so that he will be able to tolerate the pain. Next is Samroshana Karma. Samroshayetu Nainam Bishat Churnaistu Lavanaihi. So the affected eye should be irritated with powdered rock salt. So what is the logic behind this? When the salt is sprinkled, what happens? The Arma will absorb the surrounding fluid from the surrounding structures, and it gets swelled up. Okay. So once the Arma gets swelled up, it will be easy for us to hold and to differentiate the diseased part from the normal part. Okay. Tada Samroshidam Turnam Susvinnam Parigattinam. So once the part is elevated, that should be fomented and rubbed. Parigattinam, it can be mobilized. Okay, Parigattinam. Now coming to Pradhana Karma. अपाङ्गं प्रेक्षमाणस्य बडिशेन समाहितः मुच्चुण्ड्यादयः सूजीसूत्रेण वा. So primarily what should be the position of the patient's eye? Apanga prekshamana. Patient should be asked to look into the lateral canthus of eye. So what is the position of Arma? Mostly it will be in the nasal canthus or medial canthus. So patient will be asked to look into the lateral canthus, that is Apanga Sandhi, so that we get a very clear view of the part to be operated. And it should be held with 3 instruments: Badisha, Muchundi and Soji Sutra. So the Badisha can be compared to a hook like structure or instrument, and Muchundi is a forceps, and Soji Sutra is nothing but a suture with thread. So with all these 3 instruments, the Arma should be lifted up. Okay. Vartmani grahaye dridam. So in order to avoid injury to surrounding structures like conjunctiva, lids, etc., the lids must be drawn tightly. So nowadays we use a eye speculum, so we need not take tension on that part. And ullikhan mandalagrena tikshena parishodeyet vimuktam sarvadaschabi krishna shuklascha mandalat. So once all these steps are done, then with the mandalagra shastra, what we should do? We should remove all the parts of Arma from the surrounding Krishna Shukla Mandala. From underlying Krishna Shukla Mandala, we should remove the Arma attachments, and then Parishodhi, which means Chedana should be done with Tikshna Bhaga of Mandalagra Shastra. Okay. नीत्वा कनीनकोपान्तं चिन्त्यात् न अतिकनीनकं चतुर्भागस्थिते मांसे न अक्षि व्यापत्तिमर्हति. So 1/4 part of the Arma, even if we leave 1/4 part of Arma, still we have to make sure that no other parts of eye is being hurt with the procedure. That's why from the inner canthus 1/4 part must be left out, and the remaining Arma must be done Chedana Karma. So in modern science also they are giving importance so that the medial recti muscle is not getting injured. Next, in case of netted Arma yet chalavat vyapi tadapi unmarjam avalambidam. So if it is a jala like appearance of Arma, then what we should do? We should just hold it with forceps. We need not use all 3 instruments which is explained. We just have to hold it with Muchundi or forceps. And then Chindyat Vakrena Shastrena Vartma Shuklanam Ashridam. And it should be simply excised where it is adjuncted to the conjunctiva. At that point we have to just do Chedana Karma. Now coming to the Paschat Karma. Pradisarana Makshnostu Tadaha Karya Manandram. So first procedure is Pradisarana Karma with what? Yava, Trikatu, Churna and Saindavalavana. So all these 3 must be made into a combination, and we have to do Pradisarana with these combination of drugs, so that this is to prevent the recurrence of Arma. And then Svedana must be given and Bandhana must be done. And the Bandhana, after Bandhana, this part should be treated like a wound for 3 days. After 3 days, Bandhana is removed, and with Hasta Sveda, Svedana is given. And after this, the patient will be given Shodhana Karma and medicines if needed according to his Bala. Okay. So these are the Pura, Pradhana and Paschat Karma of Arma. So first we have to give importance in the position of patient, which is in sitting position, Upavishtasha, and then Samroshana Karma, and how the Arma is being held with what all instruments? Badisha, Muchundi and Suji Sutra. And after that, what should be the position of patient's eye? Apagam Prekshamana, and we should be very careful that none of the other parts are affected. And after that, Ulliket Mandalagrena Tekshnena Parishodhi. And remove from all remaining structure, and Mandalagra Shastra is used for Chedana Karma. And if it is having a netted like Jahalavat Arma, what we should do, we just simply hold with forceps and we can do Chedana Karma. Okay, and Paschat Karma for 3 days. So this is the basic Chedana Karma of Arma. So in the next class we will discuss what are the Samya, Ati and Hina Lakshana of Arma Chedana. Okay, thank you.